I'm Dr. Sri. I'm a board certified family medicine and sports medicine doctor. In this video, I'm going to discuss how I treat lateral ankle sprain as a sports medicine doctor. So we're going to talk about the various mechanisms of ankle sprains and which type of mechanisms needs to see a specialist right away. We're also going to talk about what to do right after an ankle sprain and what I do in the office and how I decide on x-rays. And then we're going to talk about how to heal the lateral ankle sprain, including rehabilitation. So without further ado, let's get started. So ankle sprains are very common injuries that can occur during various activities. So it does not have to be only sports or exercise. In my clinical practice, I treat athletes with ankle sprains as well as individuals who might sprain their ankle simply by stepping onto a curbside. Now let us understand the three common mechanisms of ankle sprains and its clinical importance. So most of the ankle sprains are usually lateral ankle sprains. So what that means is that when you sprain an ankle, your ankle goes outward like this, stretching or injuring the ligaments on the outside of the ankle. So the fractures are usually pretty rare with these types of injuries, and even if they do, most of these fractures are still uncomplicated. However, there are two mechanisms of injuries that can actually cause complications that you should be aware about. So the first mechanism is called as the eversion ankle sprain. So here, the ankle is twisting inward like this. So it stretches the inside of the ligaments or injures the inside of the ligaments, and the force travels like this, injuring the ligament that connects to the two bones here, and then the force transmits all the way, can cause a fracture on the outside of the ankle. So the other mechanism is called as the dorsiflexion external rotation mechanism. So here, your ankle is planted on the floor, your shin bone is coming towards the ankle, and then twist, so basically external rotates, like twist to the outside, and thereby causing injury. So this usually happens, so let's say someone is going for the ball and then they are planting their leg like that, and then someone pushes them away and then it just twists their ankle. So these two injuries can cause an unstable ankle, and if not treated properly, can cause long-term complications. So if an ankle injury occurs due to an eversion mechanism, so let's say this is the outside aspect of the ankle and this is the inside aspect of the ankle. So let's say the ankle kind of like goes outward like this. So it's an eversion mechanism. Or if it occurs due to the dorsiflexion, so dorsiflexion and then the external rotation mechanism like that, then it's important to make sure that you see a specialist right away. Again, what I would recommend is to see a sports medicine specialist or an orthopedic specialist, because it's important to make sure that one knows how to perform a proper clinical exam. Otherwise, subtle injuries like subtle fractures, subtle ligamentous injuries, which can actually cause an unstable ankle, can be missed. Sometimes a regular x-ray may not be enough in these scenarios. Sometimes you might have to do special views like stress views. Sometimes I might consider ordering an MRI or a CT scan to make sure the ankle is stable, which is why I would recommend seeing a specialist right away. So now that we've talked about the serious types of ankle sprains, now let's focus on lateral ankle sprains, which is the most common mechanism of ankle sprain that one might encounter. Now let's talk about what happens when you have a lateral ankle sprain. So let's go to the whiteboard here. So you see here, you have the inner aspect of the bone called as the tibia, then you have the outer aspect of the bone called as the fibula, and then you have the talus, which is the part of the bone that forms the ankle joint. So basically, when you look here, so tibia, fibula, talus, so they all form the ankle joint. So when you have an inversion ankle sprain, so basically what that means is that you twist your ankle inward like this. So basically you're stretching the ligaments here. So the ligament that you're stretching is called as the ATFL, so called as the anterior talofibular ligament. So when you stretch the ligament, you have an ankle sprain at this point. But depending on the force of the injury, so one can develop just a strain. So if you look at the whiteboard here, you can see there are three types. So one is a grade 1, where you have a stretch of the ligament. Sometimes you have a grade 2, which is a partial tear of the ligament. And then you have a grade 3, which is a full tear. So basically what that means is that your ligaments can somewhere be a little bit torn, so partial tear versus a full thickness cuff tear. Sometimes the ligament, what the ligament does is that it just pulls the bone away. So basically, when the ligament stretches, it pulls a part of the bone here, and we call this as an avulsion fracture. So we call this as an avulsion fracture. And depending on the fracture fragment, so depending on the size of the fracture fragment, we treat it as either like just a regular ankle sprain, or sometimes if the fracture fragment is pretty large, then we treat it as a stable fracture. In that case,
the person might need a longer period of immobilization. But the good thing is that these type of fractures, they do very well. You don't need surgery, and they probably might need a longer period of immobilization and rehabilitation, but still the outcome is pretty good. Sometimes, let's say the force of the injury is pretty hard, and then let's say the force of the injury could be like, somebody's like jumping from height. In that case, what happens that, so you develop a lateral ankle sprain, so you're developing a lateral ankle sprain, but the force travels so, the force is so high that it starts to affect the inside aspect of the ankle joint also. And this is what is called as an unstable ankle. So when your injury mechanism was pretty severe, which is why it's important to make sure that you have a proper exam, do a proper exam to make sure that this person does not have an unstable ankle. Most of the time, people who step on a curbside, or like let's say you're playing basketball and you just quickly sprain your ankle. Most of the time, you're just injuring this outside aspect of the ligament, outside aspect of the ankle joint. This is basically just this lateral ankle ligaments, and they do totally fine. So, and that's why I would say, like, let's say if the mechanism of injury is so severe, like for example, you're jumping from height and stuff, it's important to make sure that you can somebody conducts a proper clinical exam to make sure that you're not missing out an unstable ankle. So if you currently have a lateral ankle sprain, I would recommend following these steps until you see a doctor.
Get crutches and don't bear weight on the affected leg. So prepare an ice pack. You can use a commercial ice pack or a bag of frozen peas or crushed ice wrapped in a towel. So make sure that the ice is wrapped in a thin towel or cloth to prevent direct contact, and then apply gentle pressure to the area to increase its effectiveness. Leave the ice pack on for 15 to 20 minutes at a time. Repeat every 1 to 2 hours for the first 24 to 48 hours. Keep your feet elevated on a pillow. If you don't have any contraindication, you can do over-the-counter anti-inflammatory medications like ibuprofen or naproxen to help with the inflammation.
So now the person walks into my office with a lateral ankle sprain. So what do I do? So basically what I would do is to conduct a proper clinical exam to make sure that this person does not have an unstable ankle. And depending on my clinical exam, I would get an x-ray. Again, we talked about the fracture. Again, one can have an eversion fracture, or let's say the force was really high, the inside aspect of the ankle joint could also be affected. Some clinicians like to use what we call as an Ottawa ankle rule. So basically it's a very sensitive tool that if the Ottawa ankle rule is negative, the likelihood of a fracture is very, very low. But let us say if the Ottawa ankle rule is positive, it doesn't mean that one has a fracture. It means that one has to get an x-ray to make sure that this person does not have a fracture. In children between ages 9 to 14, growth plate fractures are a common concern. So what is a growth plate? So let's go back to a whiteboard here. So a growth plate is basically a soft part in the bone. So basically there is a growth plate that is one in the tibia, and then there's one growth plate on the fibula. So this is where the growth happens. So basically these are soft bones where there are a lot of cells that produce more bone, which thereby one can increase their height. So when you have a lateral ankle sprain at this particular age, you can injure the growth plate, and then we have various types of fractures if it involves a growth plate. We call that as a Salter-Harris fracture. And sometimes people can have only a growth plate injury, so basically just a growth plate injury, whereas some people can have a fracture that goes from the top and then can involve the bottom part of the bone, and depending on the type of the fracture, we divide it into various types from type 1 all the way to type 5. So again, if the suspicion is really high, in that case, I'll probably get an x-ray also. So now that we've ruled out a fracture, the next step is to let the ligaments heal. In order to let the ligaments heal, we need some sort of immobilization. And again, depending on the severity of the injury, the immobilization duration can vary anywhere between 5 to 14 days. So now let's talk about some immobilization options that I use in my clinical practice to help my patients.
So depending on the severity of the injury, there are a few options. If you can afford it, you may want to buy a walking boot which provides compression and comfort. This is perfect, and it can cost between $50 to $90 in Amazon. Usually with a fracture boot, patients usually tolerate weight bearing without crutches right away. Alternatively, you can use an air cast. So the gel pads in the air cast can be kept in the fridge for providing a cooling effect. The air cast helps keep the ankle in a neutral position. So this can be $20 to $30 in Amazon. If you still want a cheaper option than this, then you can buy an A-strap for less than $10 and you can do a figure of 8 brace. So I'm going to show you how to make a figure of 8 brace. You start at the foot and you create a circle of 8 wrapping around your ankle. Get crutches from someone and that should be it. It may not be as comfortable as a fancy boot, but still it works. I would recommend using the crutches at least for 5 to 7 days, but if the pain is severe, you can use it for almost 2 weeks. Early weight bearing will cause more swelling, thereby creating more pain. At least 5 to 7 days of limited weight bearing should help heal the ligaments.
So let's talk about crutches. So again, when someone has a lateral ankle sprain, sometimes it can be pretty painful to the point that they cannot weight bear at all. When I see those patients and if I place them on an immobilization option like a fracture boot, so then the pain is tolerable that they can actually start bearing weight on the ankle. Some people may not be able to afford a fracture boot. In that case, sometimes they might use an A-strap. In that case, a crutches might be necessary for a longer period of time. There are some people even after wearing a fracture boot still might need crutches for a period of 5 to 7 days or so. But the goal is to basically start bearing weight on those immobilization options slowly and then wean off the crutches as they're able to be comfortable bearing weight on their ankle. So regarding wearing the brace, usually I recommend patients to wear 24/7 except for showers during the first 5 to 7 days or so. And once they start to feel better, then they can start to use the brace only during weight bearing activities as tolerated. So around days 5 to 10, depending on the severity of the injury, one can start with the ankle rehab. I've got a complete follow along lateral ankle sprain rehab video that'll take you from an injured ankle all the way to getting back into sports, and I'll attach a video at the end of this video to help you get started. So just to provide you a quick summary, you will start with the range of motion exercises and isometric exercises, then progress to open chain exercises along with hip strengthening, and then you move to closed chain exercises to strengthen your hip muscles. If you're an athlete, I would recommend doing sport-specific rehabilitation before returning to sports participation. So most of the athletes are able to get back into the sport after 4 to 8 weeks. I usually recommend them to wear an ankle support brace for at least 3 months after an ankle sprain, but some people opt to wear an ankle support brace for the rest of their life, and that's totally fine too. But it's important to make sure that you're diligent with your rehabilitation. So you're not only focusing on the ankle strength, but also focusing on the proximal aspect of the kinetic chain. So basically your hip and core to make sure that you prevent future ankle sprains, and I've covered the hip and core exercises in my rehab videos. I hope this video was helpful. If you have any questions or comments, please post in the comment box below. And if you really found this video helpful, please make sure to hit the like button so this video can reach more people. As promised, you'll find a comprehensive ankle sprain rehab video here, and you'll find the sport-specific rehabilitation video here. And I'll see you in my next video. Until then, goodbye.